well. How are you?
Good. So today's topic is about Parkinson's, and I'm currently treating a few people. The youngest one is a lawyer. I think he's like a 50-ish.
Okay.
And your mother got Parkinson's, right?
She did. I also had two dear friends that had Parkinson at I consider early ages of 49 and 53.
49. That's early.
Yeah.
Those two friends, you don't know their diet, sugar or alcohol.
I don't. I know my mother's diet, but I don't know their diet.
So what your mother like?
She liked her sweets. She also liked her carbs. She also was an organic vegetable eater. So she did do that. She ate balanced meals, but she did like her sweets. She liked her root beer floats.
What is root beer floats?
So you have root beer, your soda or tonic.
Oh, soda.
And then you add in ice cream.
Ice cream?
Yeah,
that's very tasty.
Yeah.
But your mother has pretty good genes and live up to what, 91?
She lived to 91.
Yeah. But when do you notice the symptoms started?
So for her, they started when she was in her 80s, and then her mobility decreased so that when she passed, she was in a wheelchair for the last couple of years. And
for a few years in a wheelchair.
I could see that was hard for her.
So what's the first symptom? Is that a tremor or stiffness?
No, she never had tremors.
Oh, she didn't have tremors?
No, she never had tremors. But she had a great neurologist at the Mass General, who I think has since retired, but he was fabulous. And so as he would do she would see him every 6 months, and her symptoms were Parkinson, but she didn't have the tremors. That was the one thing that she didn't have.
But did you notice her gait change? Like she will walk like with a interesting gait.
Yeah, and also her handwriting. Her handwriting went really, really small.
Okay.
Which is what my maternal grandmother did too. But back then, that was back in the early 80s. We kind of didn't know as much about Parkinson as we do know now.
Okay.
Because Michael J. Fox has brought it a lot to light, and there's been a lot of funding.
Who is that guy?
Oh, he's an actor.
Oh, he's an actor.
Yeah.
And he died?
No, he's still alive.
Okay.
Yeah.
So I know the diet, like alcohol, because I have patients who are nursing aide. She took care of so many people with Parkinson's. And I asked her, I said, what do you think related with this? And she mentioned donuts, any kind of sweets, and also alcohol, those kind of causing nerve inflammation in the midbrain, substantia nigra, right? And there are medication to help you neurons produce more dopamine. But the problem is that it increased dopamine level, but it does not stop the degeneration of the nerves. So eventually you don't have functional nerves to produce dopamine, and so you have to increase the dosage up and up. But I heard there's a new medication, but it's very expensive, right? Yeah. So your friend, the 40-something, 90 years old, is that? Does she like sweets, or what kind of diet?
I don't know, but she did have the surgical procedure done in her brain that was supposed to help her.
Is that deep brain stimulation?
I think so.
Yeah.
She failed it.
She failed?
Yeah, and we're talking about in Boston.
Yes.
Okay.
Yes.
So she failed it, and then subsequently it happened quickly for her, and she died probably 5 or 6 years after her diagnosis.
That's fast.
Yeah.
Because I know Stephen Gundry, that a functional doctor who was cardiologist, he said his father had Parkinson's, and they control his diet, no more sweets and no more cookies, and actually he lived up to 91, and he said he almost went to what's that called, a recession, or just stop stop development, the
progression.
progression. It stopped progression. Yeah.
Okay. Nice.
So yeah, so you know, I have patients have Parkinson's and they say, oh, you know, there's no hope. I said there is a hope, right? If it's nerve inflammation, I mean, regenerate the nerves take long time. So if you destroyed part of the midbrain, then it takes long time to regenerate the nerves. And then when you have the new nerves, you have to make the right connection. But you can stop the degeneration or you can slow down. And that's the thing. Acupuncture, herbs, diet, meditation. And see, think about this way. When you meditate, you're lying down and you're pressing certain point on top of the head, and then you will bring the blood flow, bring oxygen to your brain. Then if you do that every day, then it will stop the degeneration or just slow down.
I agree with you.
Yeah, so but that's not a one-day solution. You have to do it every day, right?
Yes.
Yeah. So.
And so the other thing that I would add to it is that towards the end of her life, she was told not to eat solid foods because she would aspirate them because of the Parkinson, and she chose to eat solid foods because at that point in her life she's like,
I don't care.
Yeah. I'm gonna enjoy food. That was always an enjoyment to her.
Yes,
So,
the food. So,
yeah.
you know why people enjoy food like me? Dopamine. She loved that dopamine, and you love the dopamine with your coffee, right? Yes. Dopamine is a rewarding hormone, so we need that, but we need a little moderation. For me, dark chocolate is my job, so I have to control that part, and you have to control your coffee, not too much.
Yes, I do. I do.